Good morning, Dr. Aguirre. How are you?
Good morning. How are you?
I am doing very well, and I'm very excited that you have chosen to be live with me this morning. We have a lot of interesting information to share with our community here in San Antonio, specifically how you combine wellness and beauty. And I will just say I will invite our viewers to definitely put comments in the section because we might be able to answer a few questions and react to your ideas and thoughts if that is something that you're willing to do. If not, just enjoy getting to know Dr. Aguirre with me. So please tell us about your origins. I know you have a very specific reason why you chose the path in life that you have, and we're all curious to hear about your reasons.
Absolutely. So I was born and raised in Laredo, Texas, which is about 2 hours away from here. It's a border town. I like to think of Laredo of a area of its own. We often joke and say that we speak three languages: Spanish, English, and Spanglish. It's a very interesting merging of the American and Mexican culture, still with a very strong Mexican culture influence. I am the daughter of an immigrant, first generation for high school, college, grad, and medical school. Um, and so obviously my upbringings were very humble. But I think what really marked my commitment to the health profession was seeing access, or rather the lack of access in that particular area.
Mhm.
In particular, my mother, being an immigrant of lower socioeconomic status, insurance was unheard of for her. And so it was common practice that anytime anybody got ill, we literally crossed the bridge and access care there. Saw somebody, paid cash, and then went to the local pharmacy, picked up medications, and came back. Which is kind of a very interesting contrast to even the care I received. Obviously because of our me being a child, and the help that the government does support. I did have access to some care, but even within a household, it was very interesting to see the stark difference where I could go to a provider in the US, whereas my mother had to go to Mexico to receive her care. And just like my mother, there were many similar stories where, people went to Mexico to receive their care. And so growing up, I guess as a child, you don't understand the difference. But as I became more
Mhm.
conscientious and more aware that that was not normal, I kind of made a commitment to myself and the community that I would be able to hopefully minimize that disparity. And so I embarked on my journey of medicine, and here I am almost 20 years later. And so everything comes full circle where I would like to provide more access to individuals, and not, hopefully have them. I mean, now the situation is a little bit different where it can be dangerous. And so hopefully people don't have to be picked between a risky kind of situation and or having to receive healthcare. And so that's kind of one of the projects that I'm currently working on, improving access and maintaining it affordable, because that's the other thing too, is that just because people have access doesn't mean that it's affordable too.
Mhm. Absolutely. So, how I'm very curious, as a daughter of immigrants, how easy or not easy was it for you to realize the dream of becoming a medical professional? Because we know that is, at least from an outside perspective, not necessarily an easy journey.
Correct. Yeah,
How did
no,
you?
it was not, definitely not. English was my second language, and I think that just by nature, I think, I don't know if there's any data out there, but I think when I speak to children of immigrants, I think we all have a pretty similar consensus that when it comes to standardized testing, it doesn't come very easy to us because of that. And so, of course, I felt like I had to work twice as hard
Mhm.
to be able to achieve that. But I think for me, at least, the hardest part was getting in and getting past the fears, the insecurities, and once I was there, I think then the next big challenge is finding mentorship. And I do recall the first 2 years being pretty difficult. I felt very isolated, at least at the medical school that I was attending. We were truly a minority. Hispanics were a minority. We were maybe 10, 12 total out of a class of 400. And so, it was challenging. But
Mhm.
fortunately, I was able to meet other Latinos that were farther on in the career that took me under their wing and continue to be my mentors. And so, interesting story now, I actually am in a position to provide that mentorship to other um, minorities that may be interested in pursuing medicine. And that's one of my other big passions, hopefully encouraging them that even when there is not a member that may have that background, it can still be accomplished, and that there's still plenty of people out there that are willing to take you under their wing and support you in your dream.
Mhm. Awesome. Yeah, I love that. And definitely, I believe just by being out there and telling your story, you are being a role model and also a symbol of hope to others who are still in the situation you were in when you were a child. And yeah, so the you chose to become a DO, a doctor of osteopathy, right?
Yes.
Can you explain to us first what is the difference between an MD and a DO, and also what were the reasons for you to go down that route?
Absolutely. So it lies in the, like you said, the initials behind the DO, Doctor of Osteopathy, and then medical doctor. I think
Mhm,
for the most part, the majority of the practicing physicians are still MDs.
mhm,
Our profession is relatively young, not to be confused with just the practice of osteopathy, which is very prominent in Europe.
mhm,
And so the difference, right, here in the US is that doctors of osteopathy are actual licensed physicians, board certified, that can go into any specialty. There's two kinds of schools or models, right? We have the osteopathic and the allopathic. Again, both equally qualified and trained to see and care for patients. The big difference is in our foundation and how we are trained. So osteopathy was created by Dr. A.T. Still, who actually started as an MD. Very interesting story, and realized that there was an interrelationship between structure and function, and he saw the body as a whole, mind, body, and soul, and really felt that the body was capable of healing itself. And so, after having a very kind of devastating kind of background with having lost several of his children to a pandemic, he kind of ventured into figuring it out and really understanding the body, and that's how the practice of osteopathic medicine came about. And so, with that said, when we are trained as young physicians, we are trained to see the body as a whole, mind, body, and soul. Recently, the American Osteopathic Association came out with what we call the four osteopathic tenets and delineates that, right? Delineates the body as a whole, the interrelationship between structure and function, and the fact that the body is capable of healing itself.
mhm,
We are trained that we're not healers, but rather facilitators,
mhm,
which I think is very important. Here we are hearing about holistic and wellness kind of as a new trend, but DOs have been embracing this for years now. And so, the perfect example that I give is when a patient not too long ago, I was actively doing wound care, and so it may sound cliche, but that was a very perfect example of where the tenants came in. Patients came in with chronic wounds that could often be devastating and lead to amputations. And so the patient comes in with a hole, right, a wound. My role as a physician was to look at the patient as a whole. What are the things that are contributing to that wound not healing? What are the things that are potentially affecting or creating potentially more complications? And so
mhm,
we approach medicine literally looking at the patient as a whole. When I see patients come in, right, commonly they say, well, I have headache or I have back pain. It may be very easy for us as physicians to say, well, what's causing? Is there an injury? Is there somatic dysfunction, which I will touch in a little bit? But most often than not, when I really take the time to sit down and ask the patient, well, what's going on? Then I find out that they haven't slept for weeks, that they're very anxious. They may or may not be eating well. They may or may not be exercising. And so all those are things that really contribute to the overall health of the patient. And so being able to kind of look at the patient overall and what are contributing to their ailments is important. Earlier, I touched on somatic dysfunction. That is an extra tool that we learn as DOs, where it's called osteopathic manipulative medicine. It is a training that all DOs get. Some may or may not use it, but it is pretty much, again, using and understanding the interrelationship between structure and function.
Mhm.
I guess the best way to put it is kind of a blend between a chiropractor and a doctor, where we're able to have hands-on and physically manipulate, some structures that may be interfering. Perfect example is sciatic pain, pain that kind of starts in the glute and shoots down the leg. Most often, right, we give pain. We give either nerve pain or an anti-inflammatory or some sort of other pain. And so there is a technique that we can do where we can relax the muscle, and the patient can essentially walk pain free within a couple of minutes. But that is an extra tool that DOs do have under their belt.
Mhm. Well, that is very attractive to me, and I will say that I also have on in my personal life have dealt with chronic illnesses and pains that eventually were under total control, if not even in remission, because I was open to an approach that encompassed diet and lifestyle changes. So it sounds to me like you're very much open to that, and also knowledgeable in that, trained in that. And that sounds like a very interesting approach to medicine. And yeah, I definitely want to acknowledge our viewers here. I blended in earlier, but we do have Nadia Butawi from Ann Arbor join us, and I know she's very helpful in healthcare for companies who try to implement technology and try to vet whether that is a good approach for them or not. And then we had Jason Zetzer here explaining how he's impressive when people reach great great things in their professional and personal lives as a second, with English being the second language, right? And we see that with immigrants in general. It's just something that is nice when you have that different perspective. And I don't know if that is a thing here in the United States, but in Europe they always tell students who are interested in medicine to go and study Latin, because
Hmm.
apparently everything you learn at med school is based in Latin. So is that true here, or would you say so?
Yeah, to a certain extent, yes, yes.
Okay, so with you having a Latin-based mother tongue, that was then somewhat easier sometimes to make sense of these medical terminologies, right?
To a certain extent, yes.
Awesome. So it is true. I never touched Latin though, but I did dabble with some French. All right. So what you explained, your global holistic approach. I'm gonna blend in your website here so people can see. Also, if you want to go and check Dr. Aguirre's website out, let me blend in the URL here. Okay, so scrolling down a little bit, what it says, a person is a unit of body, mind, and spirit. So that is, I believe, in a simple sentence, what you alluded to earlier. But let me ask you, how did you, or how do you apply that in your practice?
Absolutely. So I think what a lot of people don't may not know is that aesthetic procedures, in particular, very popular aesthetic procedures like Botox, and fillers, are considered the practice of medicine. It
Mhm,
is by law that they need to be under the regulation and assessment of a physician.
mhm,
Obviously, common trends are a little bit different. You often see other healthcare providers that are delegated to that practice, and so. again, it is the expectation that any patient that wants and proceeds with these kinds of procedures have an actual examination. And so, with that said, for me, that's an opportunity to assess the patient. Obviously, you know the regulation or the law says that an exam has got to be done. Of course, that can be very minimal or it can be very extensive. For me personally, because I'm very interested in the overall health of the patient, it is an opportunity for me to understand more of, obviously basic, any medical history, allergies, complications, skin conditions that may lead to complications, but also, the mind, the state of the mind, is there underlying depression and underlying anxiety? And often than not, that has been an opportunity for me to have other kinds of discussions with the patient. I had a patient who came in for Botox. We did the assessment and then came to find out that she had a plethora of other medical conditions, and blood pressure being one of them. And I think she had kind of lost faith in the healthcare system. She said it was difficult to get in with her primary care doctor. At some point, she was under so many medications, she was taking medications for side effects of those medications. And so
Mm,
she kind of was like, you know what, I'm done. But obviously, she wanted to look good. And so that was an opportunity to educate her and say, while, I want you to look good, I also want you to feel good. And
mhm,
I, in good conscience, cannot just let you walk away with a blood pressure that's high. I'm
mm,
sorry that you've experienced what you have, but, if you will allow me, I think the key really is a partnership where physicians don't know it all and are in all, but rather are willing to form that partnership with that patient, know their limitations financially, emotionally, spiritually, and say, where can we meet halfway? Because, we can get you Botox today, but if you end up going home and having a stroke and or God forbid, end up with heart failure, then, what good does that do to you?
mm,
And so it opens up, right? Because we know we have to do an assessment. It allows for me to have those discussions and say, you know what? But also because I am a physician, I can address those things. I can have
mm,
those discussions, as opposed to the care having been given by somebody else that's not trained or equipped to provide that kind of guidance and support.
mhm. Yeah, I like that, especially as a marketer and someone who always thinks about how can you, we say in marketing, how can you wrap the medicine with bacon, right? So that the bacon is what the person comes for when then they get the medicine, when they go for it. And so I think with the approach of focusing on beauty and aesthetics, that is really smart what you're doing, and in a way also the beauty is a representation of the body itself, and also and that is a on the physical and mental side. And I think it's really interesting what you do and that you take that approach. Now, you mentioned that it's very important to have a trained medical professional work in that environment. Do you see that that is sometimes not the case?
Unfortunately,
Mm,
I think that aesthetics is a rapidly growing industry. I think that we've come to the realization that it goes hand in hand with wellness. And so we're seeing a lot of that marriage into aesthetics and wellness. As I said earlier, common procedures such as Botox and fillers are considered the practice of medicine. Therefore, they do fall under the jurisdiction of a physician.
mm,
Obviously, every state has different regulations and different laws. Here in the state of Texas, it is to oversee the role or the title of that physician overseeing the aesthetic practice is called a medical director. As of right now,
mm,
there's not very specific guidelines in terms of what kind of training the medical director needs to have. They can be in completely, totally opposite specialties. But we would hope that they would have at least some training or knowledge, given that they are delegating the practice of medicine to either a nurse practitioner, PA, or RN. In the state of Texas, estheticians can engage as well, but again, they're all under the supervision of a physician. By law, a medical director should be available for complications. There should be a physical exam. It's often more the practice that it's a non physician providing these services, than not. I think that I'm kind of a unique here, where I
Mhm.
was adamant that I want it to be the one doing the assessment and the treatments. But with that said, it is important that whoever, um, engages in these kinds of practices is appropriately and thoroughly trained. It
Mhm.
may appear as a very benign procedure, but there are complications with
Mhm.
neurotoxins, Botox, Jeuveau, Dysport. All those are what we call neurotoxins. Those are medications used for relaxing muscle contraction, therefore it help with frown lines, so on and so forth. With those particular medications, we don't see really long-term complications. It's very temporary. But with fillers that we use for enhancement, volume, kind of helping with some of the aging process, you can have occlusions. Probably one of the worst are strokes, and we don't often talk about that.
Mhm.
Obviously, as these procedures become more prominent, we're seeing more and more of these cases. And so I think having a healthy respect of the anatomy and understanding where those vessels that can lead to pretty significant complications is important. And most importantly, having a good relationship with your medical director so that if you do encounter a complication, the patient doesn't fall through the cracks. Sometimes what ends up happening is they go to the ER, and the ER providers are not trained to handle this. And so there's often delay, which can lead to necrosis, can lead to ultimately, scarring, deformation of the face. And so we don't get training. And so any training that we get, we don't get it at least in medical school. We have to go after the fact and kind of train and seek these trainings on our own. And so again, I cannot emphasize the importance of ensuring that you go to a provider that's appropriately trained and appropriately supported in case there are any complications.
Mhm. Well, and I mean, it goes without saying that at your clinic, that is all followed to the T, right? Exactly how it needs to be done. And I thank you for that. It's really important to uphold that standard and quality. Let's talk a little bit about access and affordability, because that is really, those are two huge keywords
Yes.
that are going to be of interest to our San Antonio community. So, what's your approach to access and affordability?
Well, one access, I think it's at multiple levels, right? Having
Mm.
a provider, we know that it's no news that there is a shortage of healthcare providers. I think that the pandemic came to kind of really show us where our weaknesses are. And I still think that, there's still a lot of growing to be done in terms of meeting the demands and the needs of the healthcare of our community. And so with that said, we know that access is already limited. But even with that, I
Mm.
think access to culturally sensitive and competent as well
Mm.
providers, because I think as with Laredo, San Antonio is a predominantly Hispanic community. And so even just having access to a provider that speaks your language, that understands your language, is important, because sometimes that could be the difference between compliance and not. Um,
Mhm.
so at least for me, those are the two things. One, making sure that I'm available. And two, that, patients that may be hesitant or reluctant to seek a healthcare provider can find somebody that may be relatable and may be willing
Mhm.
to work with them.
Mhm.
So that's access at the level of having just access to a medical provider. But I think too, access in terms of affordability. Here insurances are pretty much a standard of care, right? It's what most people seek and seek as the ultimate. That's what's going to help me get better and or stay healthy or prevent complications. But unfortunately, because there's not enough access, we're seeing where even patients with insurance can't even access their healthcare provider. How many times we've heard of patients say, I can't get in for
Mhm.
4 weeks, 5 weeks. I'm sick. I need to be seen now, but I can't get in for several more weeks. So even there, we see
Right.
how both access and affordability will come in hand. And so my goal is to hopefully keep access also for uninsured, where our services are affordable.
Mhm.
There is one, and I'll speak specifically to one specific service that we provide that falls right under the aesthetic component, but it's very much medical.
Mhm.
It treats urinary incontinence. Many people may not know, but urinary incontinence affects about 60% of women, and it is a condition where you may cough,
Wow.
sneeze, and have urine leakage, and or wake up multiple times in the middle of the night, which therefore affects your ability to sleep. You end up with fatigue. Again, the overall individual. But it is very prevalent. When you go to your doctor, your options are a medication, pelvic floor, exercises with physical therapy, or getting surgery. Those may or may not be covered by insurances. It may or may not require off time from your work. Obviously, the implications depending on the severity. Some patients may say, whatever it takes, this is very embarrassing. I need, I can't afford to do this anymore. And so we actually treat that here, but it falls, the device that we have is non-invasive, but it falls under aesthetic. But again, for me, it's something that I realize the importance it is of it, right? And how prevalent it is. And so my goal is to be able to make it affordable and accessible to as many women as possible. And with that, we do take some pay now or purchase now, pay later kind
Mm,
of systems where patients can, break it down and have access to this kind of technology. For me, it's been very interesting to see how much of the stuff that I was seeing in my primary care practice, I'm able to manage here now at a much more affordable price and with hopefully a faster turnaround than I
mm,
could in my primary care office.
mhm. Nice. So let's see, where are you located? And let me blend in your URL so people can get all the information if they are interested in seeing you.
Absolutely. So we're in the Stone Oak area, off of 1604, very close to 1604 and 281, literally right next to Baptist Hospital. We
Mm,
are in a medical building. We're in the first floor, and we're very conveniently located next to an imaging center and a laboratory, which I think it's any primary care doctor's dream. You have everything
mhm.
literally right next to each other.
Okay. And how about social presence? Where is there a social platform that you enjoy?
We do both. We do Facebook, Instagram. I grew up with Facebook. I was in
Okay.
college right when Facebook came out, so I think just by default, Facebook is my go-to. But I'm learning the ropes of Instagram and
Okay.
TikTok and all those platforms, and so we have
Love
a
it.
considerable.
Okay, so if someone wants to reach out there, they can try that as well. I'm pretty sure on your website you have references. That's probably the easiest way to get a hold of you. I see there's a coupon also available on your website, so definitely check that out. Yeah, I'm very grateful you took the time this morning to chat with us. Is there any final thought you have that you want to leave our viewers with until we wrap this up and see who goes and checks out your website?
Thank you. Well, first of all, I want to thank you for the opportunity of allowing me to use your platform to help educate. Education, is something that I'm very passionate about, among many other things. But we do it here every month. We do offer education lectures for people to come and learn about the products, about conditions like we were talking about with the urinary incontinence. But I think the last thing that I would like to close with is just empowering patients to want to know more, get involved with your care,
Mhm,
ask about who's taking care of you, ask about their training, ask who their medical director is, ask if there's any complications, who do I reach out to, what do I do. I think most often we think that we're how dare do we ask or question a provider, but I think that's why our care is so fragmented. We
mhm,
truly need to be partners with them. We really need to be involved. If there's something that doesn't work for you, whether it's because of side effects, money, whatever it is, bring it up. The important part is being compliant. I think providers and patients both want the same thing. They want a good quality life long term. And so
mhm.
having those discussions, they may be uncomfortable, but so what? That's part of it. It is your health, it is your body. You always have a say so, and you always have an option. And so make use of that.
Absolutely. Well, I think I'm absolutely on the same page with you. That's really one of the main reasons I like to offer my platform to drive education. I also have quite a good amount of other healthcare practitioners in San Antonio who are within my network. So if they want to collaborate with you or be referral partners, I would say you're open to that as well.
Absolutely.
And yeah, following on Treya here, thank you very much for coming, Dr. Aguirre. And I would say have a wonderful rest of your day. People who have questions for you should reach out to you through your website or even through your social profiles and just ask, and you will help.
Absolutely.
All right. You have a wonderful day and see you very soon on my platform.
Thank you.
Bye bye.
Bye.